So liver transplantation in an adult. No, we don't have to remember all of them or anything. Just remember some of them. Okay, I'll tell you the sum. What you need to remember is active sepsis, malignancy, alcohol. So just remember that the patient is having active sepsis. If you do a liver transplant, what's going to happen? Think of it that way, because most of your questions are going to be MCQs, right? If you do a transplant also, the patient is having sepsis, it's just going to worsen the liver. The graft is getting infected. The patient is taking alcohol. The purpose for which you did liver transplant itself is lost. The purpose is defeated. The patient has got a malignancy. What happens? If you do a liver transplant also, it will ultimately metastasize to the liver. And will the liver be able to take it? No, because post-transplant, you are putting the patients on immunosuppressants. So what is the side effect of immunosuppressant? That itself is infection. So if a patient has active infection, you cannot. And it will also worsen the malignancy. That is the most important thing. If you give immunosuppressants, long-term risk is what? Infection and rejection. Of course, chronic graft rejection, infection and malignancy. So that is, so if the patient already has infection, the patient is taking alcohol, already has a malignancy, there's no point in doing a liver transplant. So just remember the absolute contraindication. That's more important. And of course, AIDS. AIDS is when it's less than 100, right? When your CD4 count is so low. The other thing is just HIV with a good CD4 control. So that is a laxity. The patient is good. He's doing well. Even a patient is above 70 years also, that alone you just remember maybe. Above 70 years, it's not considered as an absolute contraindication, say relative. And like I told you, portopulmonary hypertension, hepatopulmonary syndrome. Ideally, they are given much importance. But if it goes very high, then you think, okay, hepatic vein thrombosis versus portal vein thrombosis and liver transplant. Yeah, definitely you can transplant. Even if there's hepatic vein thrombosis, that is hepatic venous outflow tract obstruction. That's what is hepatic vein thrombus. If the patient has got a bad liver with a MELD score elevated, definitely you can transplant. A simple portal vein thrombosis, you do not have to transplant. See, what decides whether you have to take up transplant or not? The MELD score, right? So what does MELD comprise of? It comprises of bilirubin, your INR and your creatinine, right? That is your simple MELD. Otherwise, you have something called as MELD sodium. So MELD sodium, what is the importance of that? It helps to reduce the mortality in the waiting list. So you have a waiting list of patients who are having liver transplant.